We have Dr. Gundurao with us as a speaker for this weekly meeting. He began his professional career as a grain storage technology specialist and worked for a few years at CFTRI in Mysore. He then shifted to laboratory medicine. He joined the Department of Pharmacology to be trained in toxicology at the University of Minnesota. He's been with this university for over 40 years now. He heads the Department of Laboratory Medicine, Pathology and Anesthesiology at Lille Heart Institute and Biomedical Engineering Institute at Minnesota. And we are very happy to have you here amidst us this morning, sir. Coming from the healthcare background and Rotary having one of its biggest focus areas to be healthcare, it's really interesting to understand that you have a lot of passion to make a difference to the community in the healthcare segment particularly. It'll be nice to know, some background about this kind of a shift that you've made from initially what your career was to what it is now.
I started off as a grain technologist, as you said, because I wanted to come back and develop scientific storage of grain and food products. But since I did not get a job here in India, I stayed on and developed experience in biochemistry, pharmacology. In view of my research in the area of thrombosis, I was invited by Government of India in 1990 as a United Nations consultant. So I visited all the major medical institutions from Srinagar to Trivandrum at that time. And I came again in 91 and 92 under this United Nations program. During that time I realized that India had two major epidemics. One was the coronary artery disease, high incidence, and the other is the type 2 diabetes. And people were not aware of it. Therefore I started my own professional society to create awareness and develop prevention strategies. And this society, called South Asian Society on Atherosclerosis and Thrombosis, has been doing this work for last 20 years in India, and we have organized conferences all over the country. I've published 5 books on this subject. That's how I got interested in the healthcare part of it. And what has happened is, although we have organized conference in India for a number of years, we have not reached the community level to develop these prevention programs.
Right.
So much of our awareness program is at the level of the clinicians, physicians and researchers. Therefore now we would like to take this message and develop a easily accessible, acceptable and an affordable healthcare.
Absolutely, sir. Coming from a very advanced nation like US and being a part of the medical science over there, and having been a Rotarian in Minnesota in the past, what do you see as major challenges in the healthcare domain in India?
Various funding agencies and the news media, etc. Many a times they talk about HIV/AIDS, cancer, etc. But the way I would like the prioritization take place is in terms of number. If you go by that, if you look at earliest stage where the disease develops, it is when the child is growing in the womb. So if you look at that particular situation, even today in India, 30% of the children born are of low birth weight. It's a huge number. And these 30% of the children who are of low birth weight also develop cardiometabolic diseases like heart disease and diabetes. The next in line is the anemia. If you look at the school-going children, especially girls, almost 70% are anemic. And even boys, 39% are anemic. If you look at the death in pregnancy, 24% is due to anemia. So that would be, I consider, the second priority. Third is the malnutrition at every level, at the neonatal, adolescent level. And then comes other things like blood pressure, obesity, coronary artery disease and diabetes. So we have to look at the pyramid bottom, covering the largest population. If you look at the cancer and HIV, it's only 5 million. If you look at diabetes type 2, it is 65 million. So that number should say, what should our priority be?
What do you think as Rotary as an organization we could do to bring about some kind of change, or how do we address these challenges? If we were to address it as a club or a group of clubs, what do you think should be our first step, if it has to happen at a local level?
See, in the Rotary movement, for example, there is a classical achievement, that is the polio eradication. At the level of the Rotary clubs internationally, one can select areas of interest which is universal. But in that situation, they have paid attention to infectious diseases. However, if we look at India, where quite a bit of infectious disease has been reduced, polio has been almost eradicated, it is time that we take the non-communicable diseases and pay attention. Heart disease, diabetes, type 2 are preventable. Same way, anemia, preventable. Malnutrition, preventable. So, to start with, we should educate Rotarians and Rotary clubs about the importance of prioritization, about developing signature projects in each club, and also sustaining the activity.
Right. In fact, yeah, I was coming to what should be our focus areas if we were to get into sensitizing the community and building awareness and of diseases and its prevention. And more commonly, apart from diabetes and heart diseases, which most people are now becoming very alarmed about, and the knowledge base is increasing, is there something else that we can look at? You were mentioning something about malnutrition, anemia. So is there something that specifically you urge us to take it up as a priority project?
Absolutely, because if we look at this problem of maternal nutrition, it's not that these ladies are not eating. They are eating, but they are not having the micronutrients. Therefore, for example, if we develop a easy way of getting them the needed micronutrients into their food, that will be the greatest contribution. Having said that, we'll have to figure out how we do that. We can have a small tea bag like thing which can have the nutrients, you can add it to your food or whatever. That's one way. On the other hand, at a national level, some of the basic foods that we eat could be fortified so that they have their daily requirements. If I take any processed food in America, they all have their daily requirements of micronutrients. So we get everything including water, which is added value. And although Government of India started a long time ago making this enriched bread, it's not available at all. So there is plenty of opportunity for us to correct that problem of malnutrition for the would-be mothers, or for the child which is growing, or the neonatals, and the 1 to 12th grade children. And also one should have a supervision of all this midday meal, etc. Are they nutritious? That's one thing. But on the other hand, a lot of people don't even get food. So we'll have to look at it in a bigger perspective. First, everybody should have to have some food so that they're not hungry. Then everybody should have food that is of quality, hygienic, so that we don't have the situations like what happened in Bihar. and it should be wholesome.
You're also a very staunch believer of alternative healing and a combination of modern medicine with traditional healing therapies. Would you like to share some thoughts of yours on that?
Absolutely. The reason why we are interested in the alternative medicine is simply because if you look at the faith and the belief of the Indian community, in any given house, one will probably go to allopathy, other prefers homeopathy, other a Siddha or a Unani, whatever it is. So people have 5 or 6 choices in terms of what they want to do in having healthcare. And it's all built on their faith and their appreciation or the ear of the mouth that this is good or that is not good, whatever it is. But there is no standardization of these things. Secondly, if you look at telemedicine and all those things, it's all allopathy only. In India, when we have not been able to provide any kind of health care for the rural mass, which is almost 60%, we want to bring some kind of a platform where we have all of these alternative medicine in the same platform. And what it does is that if we can develop a diagnostic platform at the level of taluk and ability to take that diagnostic data into a web or cloud or whatever, then we can give a portal where the consumer can opt for the type of therapy they want, whether it is Ayurveda, yoga, whatever, and have a one-to-one consultation, which is not available. And this will save a lot of cost. You don't have to send a doctor to village. The doctor comes on the virtual and discusses, and according to Devi Shetty, only 10% need any real hospitalization. Other 90% can use this type of a platform, get electronic prescription, drug delivery at wherever they are. That's the type of healthcare I am dreaming of. And with the help of IT people and the Rotarians and the healthcare community, I think probably we'll develop something like that.
Absolutely, sir, which will definitely enhance the reach of people to healthcare, the access for better healthcare amongst people. Having discussed about that, maybe it would be apt at this point of time to talk about the innovation in healthcare, the partnership model probably, and what's your thought on that? Do you think key stakeholders, agencies can come together to work towards better access to health?
Innovation is very critical, and innovations can improve the type of healthcare we deliver. I'll just give you only 1 or 2 examples where we can change the way we practice medicine. Like for example, in Bangalore, a group of engineers and technologists have developed a screening called Trinetra. This is by Forest Health from Bangalore, and they have developed a in-house developed fundus scope, but they have used innovative technology just by taking what is available in the market, like a camera and a software development, so that they can take the image and send it to a platform. And this has revolutionized the way images of newly born are taken and sent to ophthalmology. And based on this community-based study, they have found that 30% of the newly born children have eye problems. Again, this correlates with what I told you before, that malnutrition causes low birth weight, and it also causes side effects because certain nutrients are essential for the development of the eye. So that's one very innovative area of taking the entire healthcare to the level of the community. Same way, we are interested in using these type of technology to image wherever it is possible, like ear, nose, throat type of cancers. Using fiber optics, we can image and send it to the eye. But what is missing? Missing is the service provider. How do you provide service? You can take an image and send somewhere, but somebody has to be able to interpret and provide that service. So there's a tremendous opportunity here for us to develop diagnostic tools at the innovation level and applications to manage disease and application to alert the patient and applications to have a portal you monitor your own health. Bangalore, for example, is the IT capital. We hardly have used this IT knowledge to expand our healthcare capabilities. So we can bring all innovation in terms of improving the health.
Absolutely. Integrating technology into
Absolutely.
reaching out to a larger community base. What is your thought? Do you think there is a scope for social enterprises to kind of be urged to reach out to the healthcare segment in the rural areas? Do you think that is something that would work, and what do you think would be the probable challenges there?
The biggest challenge is to find dedicated groups who can go to the community level and do this type of work. And since it is not a revenue generating project,
Right.
many a times it has to be sustained by what is available in terms of funding from the private-public partnerships. Unfortunately, what has happened is we do not have enough of funding agencies which can match and support the NGOs to do this type of work. Therefore, we have to find a mechanism as to how we can improve that. And one of the things that I suggest is, if you go to a village level, for example, in your own club, you are thinking of Kolar and adopting a village. If you go to the village and develop this, instead of going and saying, I'm going to bring this to you, you ask them what is it that they want. Do a survey of the needs of the community. Based on that, you develop the solutions.
Right.
In such a situation, one can say that if they want something, there may be a scheme, either private or public, which can fund it.
Right.
Then it doesn't matter how we develop it, we can find a source of funding. Whether it is the BPL for health or the NRHM for health.
Yeah, there's several
Whatever.
schemes.
There are so many schemes which are probably not used very well.
Right.
Since we are all educated, talented people,
Begin
we
with
can help them to get these things. We are not investing anything other than knowledge.
Right.
So we can use our knowledge base and our compassion and our need to do some service, passion to do some service, and develop this type of programs where you can use your talent to find out what are the requirements, prioritize, then see where you can get that funding nationally, internationally, and you can work in that type of model.
Absolutely. How do you think Rotary can influence the government in particular to influence their spending on healthcare, the policies they have towards healthcare, particularly in the rural development, keeping the rural development in mind? Is there something that you can?
Yes. See, in all our professional society, when we reach a point that we have achieved a certain degree of credibility and validity and visibility, we develop what we call consensus statements or white papers. And Rotary has done extensive work at the level of community in a variety of situations. So now if we take our Rotary district and say, we will develop a white paper for this type of activity in the state and get endorsement from all the 50 clubs or 52 clubs on a proposal that we want to do as a Rotary project for the state of Karnataka. It will be a greatest achievement because we bring all the Rotary on the table. We can say this is a prioritized important project.
Absolutely.
And we say that the government should take this very seriously
Absolutely.
and do it. Because once we show that at one state, other states can do it. We can take it to the international level. It can go to all the resource poor countries. WHO or United Nations can use it as a Rotary model. So there's plenty of opportunity for Rotary to influence and interact because it's a club of the elites, club of the intellectuals, club of the people who have a passion to do things.
Right.
And that has to be channeled, and we have to go with our collective strength.
As Rotary E-Club, that's one of the primary areas of focus that we have to reach out to the rural segment as far as healthcare is concerned. Really thank you for summing it all up for us in a very nice manner, and we will look forward to more inputs from you as the year goes by, and we really wish to do a lot more for the community. Thanks for being here with us.
Thanks for inviting me, and as a E-Rotary Club, I would like to see that we create visibility in the international level so that many more clubs join in our efforts.
Absolutely. Thank you so much.
Thank you.